Welcome to the Clear Gun Show. I'm your host, Dr. G, with a PhD. So a bunch of stuff happened over the weekend, and it's so much news that I'm going to try and break it down by country this time around, so we'll see how that goes. So for starters, we'll start with the US, then we're going to go to news in Australia and New Zealand. From New Zealand, we'll be going to Germany. We'll finish country-wise with a big block in the UK. I'll be wrapping up the whole segment by breaking down a paper that came out on December 8th, and this is the first paper of my knowledge to quantify and dissect how many unvaccinated people you'd have to exclude from the general society or from general things in the society like plays and soccer games and stuff to prevent one SARS-CoV-2 transmission. I think you'll find the results are incredible. So we've got no time to waste. Let's get on to it. So we're going to start with the U.S. And now before we start with anything COVID related, I want to do a shout out and thoughts and prayers to the citizens of Kentucky that just had several tornadoes rip through the state. And they're estimating now that the potential loss of life could be over 100 people. So thoughts and prayers to the community of Kentucky. And I'm hoping for a quick and swift recovery. So for starters, we're going to do what Jen Psaki loves to do so much, and that's circle back. And we're going to go back to a topic from last Friday, and that was where I showed the kids eating lunch on those isolated buckets outside in the cold in Oregon. Well, Jen Psaki was asked a question about that particular event and those particular events that are happening across the country. Here's what she had to say.
But inside schools, there are often very strict rules. For example, sometimes students are required to eat outside or eat distant from each other, not talk to each other while they're eating. Does the White House want to see those rules lifted as well to get back to a more normal school experience?
Well, schools are taking steps, especially since we've only recently approved through the CDC and FDA vaccines for 5 to 11-year-olds. They're not approved for kids younger than that, to keep their kids safe and keep students safe. I will tell you, I have a 3-year-old who goes to school, sits outside for snacks and lunch, wears a mask inside, and it's no big deal to him. I'm not saying that's the case for everybody, but these are steps that schools are taking to keep kids safe. And I think the vast majority of parents appreciate that. Obviously, we want to get to a point where we're turning to a version of normalcy for everybody, right? Where you're not sending your kids backpack with 7 extra masks, right? Where you're not adding 2 hats so that they're warm outside for a snack. There's no question that's the case, but we also think the most important thing should be safety, the safety of kids, keeping kids in school, which the president is very focused on, and some of these steps, creative steps that schools have taken, have enabled that to be possible.
As we discussed on Friday, I don't think these particular rules for children are doing anything in terms of prevention. Furthermore, I think it's accelerating, or it's one of the factors accelerating the depression and anxiety seen in America's youth all across the nation. So the fact that the secretary is defending this is just terrible. Now, speaking of children and health, ABC released this tweet, and I'm going to read the tweet for those that can't see, and it says, with nearly 5 million children ages 5 to 11 now vaccinated against COVID-19, CDC Director Dr. Rochelle Walensky says real-world monitoring finds vaccines are safe for young children. Now, the way that this is written, it almost makes it seem like they didn't know things were safe before going ahead and telling people to inject children with this particular mRNA vaccination. Now, that's just the fault of ABC's writing, but as we've discussed many times before, this particular vaccine cannot, just because of time and many other factors, but time is one of the easiest to talk about. We cannot know the entire safety profile of this drug the same way that we would of several other drugs. That's just a fact. Now, the writing of this tweet, again, is not particularly good, so there's that too. The CDC also, as of December 9th, expanded their COVID-19 booster recommendations to 16 and 17-year-olds. Now let's take a look at a COVID-19 update issued by Cornell University on December 11th. Now, I think we're going to see this trend across a lot of universities in the US, and let's see what they have to say. So they had identified nearly 300 cases over testing from Friday and Saturday. Now, from those findings, they said that a majority of them were linked to off-campus student social gatherings where masking and public health measures were not followed. Right after that, they bold this. Being vaccinated, even with a booster shot, is not a license to let down our guards. This kind of sentence always brings me back to my usual chorus, and that is, what's the metric? At what point can we let down our guard on COVID? If being fully vaccinated and booster shot vaccinated on top of that isn't enough, what is it going to take? I am not entirely sure because they never say. So here there are 3 critical updates. All in-person student gatherings, formal or informal, are canceled. Second update, in-person exams will continue as planned as there have been no evidence of classroom virus transmission. How convenient. And then the December recognition ceremony in Ithaca will continue as planned. They also suggest that you have to wear masks indoor at all times except when you're in your dorms, even to mask outside if you can't physically distance to whatever distance they say. They say use grab-and-go food options or try to spread out from others, and don't linger. You can't linger or enjoy eating. You have to do it all super fast. You have to put your mask back on as soon as you're done eating or drinking. Because as we know, COVID is just waiting like a ninja for the second you're done eating or drinking, that's when it strikes. Not when you're eating or drinking, just right when you're done, COVID is there. Boom. And again, I can guarantee you we're going to be seeing a lot more of these kinds of updates. Before we get to our last US story, which is New York, let's take a quick trip down memory lane and see what CEO of Pfizer, Albert Bourla, had to say about the vaccines and how they were sold to us. This comes from his Twitter on April 1st, 2021. Excited to share that updated analysis from our phase 3 study with BioNTech also showed that our COVID-19 vaccine was 100% effective in preventing COVID-19 cases in South Africa. 100%. The data also showed the vaccine was 100% effective against severe COVID-19 as defined by the CDC and 95.3% effective against severe COVID-19 as defined by the US FDA. Very reassuring news. Remember, that's how it was sold to us. Prevents cases from spreading and prevents severe hospitalization. And then remember that this past summer, for a couple of months, maybe a month and a half, everything was really groovy. It was very cool. Now let's see what he has to say on December 8th about the boosters. So far, the science tells us that fully vaccinating as many people as possible with the first 2 dose series and a booster as quickly as possible remains the best way to prevent the spread of COVID-19. In our fight against this disease, we will continue to follow the science. New. Initial lab studies show that 3 doses of the Pfizer COVID-19 vaccine effectively neutralize the Omicron variant. Now look, I'm not saying he's wrong about everything or that he's wrong about this. I'm just saying he has been wrong. And we were sold a bill of goods that was not actually realized. And so when looking to the future, I think we should be skeptical. I think we should ask questions. I think we should ask for all the data. There's a lot of things to be reasonably skeptical about, especially when this guy made this exact same call, back in April with the first round. Now let's go to Governor Hochul from New York.
I today am announcing that we are enacting a statewide indoor mask mandate unless a business has a vaccination mandate. Many people in New York City are already dealing with this. Been dealing with it for a while. You've been doing great. And that is why your hospital capacity is good. That's why your vaccination numbers are high. Your infections are not as high as the rest of the state. But the rest of the state now has a wake-up call.
The rest of the state has a wake-up call. Let's go to the AP and see what this mask mandate's all about. So Hochul based the decision on a rising number of cases and hospitalizations, which have been especially pronounced in parts of upstate New York. Now, New York previously had a mask mandate from April 2020 until the end of June 2021, and that was for vaccinated individuals ending in June 2021. The new mask mandate applies to both patrons and staff and will be in effect from Monday until January 15th. Violators could face civil and criminal penalties, including a maximum fine of $1,000. Now, New York City requires vaccination for indoor restaurant dining, entertainment, and gyms, so those vaccine-requiring venues are not going to be affected by the new rule. So here are the numbers according to the AP, which sort of instigated this mandate. The state recorded more than 68,000 positive tests for the virus in the 7-day period that ended this Wednesday. That's the most in any 7-day stretch since the start of February, and rates are rising in nearly all counties. Now let's go to Australia and New Zealand and break down a few videos from these 2 countries. You guys already know this is going to be crazy, so buckle up. So we'll ease into the crazy with a report from New South Wales on who's getting COVID.
New South Wales Health is seeing an increased number of cases over the last couple of days, and what we've been observing is increased transmission in larger social venues such as pubs, clubs and party settings. This is contributing to an increase in cases, and they're predominantly occurring in vaccinated individuals. So my key message is don't attend any functions if you have any symptoms, however mild.
So her key message is to stop being a human in society. So that's great. Now let's take a look at what Australia's Raptor Police Squad is being charged with.
It was a violent confrontation at a Western Sydney petrol station. 5 men who police claimed had links to a criminal gang clashing with Raptor Squad officers. But now police have withdrawn the charges and they are likely to be sued.
Police describe Strikeforce Raptor as proactive.
Now these knees. 1, 2, 3, 4, 5.
A specialised squad that targets the criminal activity of outlaw bikie gangs.
I'm not doing anything, brother.
But on this day in September, they were cracking down on offending of a different kind. A group of men who were not wearing face masks. They were Khalid, Hussein and Fadis Raker, along with 2 others. One is arrested before a melee erupts and backup arrives.
They didn't do anything, they just didn't have a mask on.
The men say they went into the shop to buy some. Raptor officers say they were attacked first. Khalid's Raker used both hands to take hold of the police vest and threw a flurry of closed fist punches to the officer's head and torso. On the ground, he continued to use his arms, elbows and knees to strike police. But security and phone video contradict that, and all charges of assaulting police and resisting.
So not only did the police drop all the charges, they're being sued by these guys. And what's amazing is these guys, ostensibly by the video, were going into the store to buy masks to use. Then they got totally beat up and the police said they were resisting arrest and fighting back, when in the video the guy said, all right, stop hitting me. What a total abdication of duty. These cops deserve to be punished to the fullest extent of the law. In equally crazy and ridiculous news, a husband and wife could not go to the morgue in another territory in Australia to identify their recently deceased son due to the COVID restrictions. Let's hear a bit of what they have to say.
A grieving mother and father from Williamstown are pleading for Western Australia to relax its border restrictions after being denied entry to identify the body of their 20-year-old son. But Premier Mark McGowan is standing firm, insisting the harsh rules are about protecting his state.
A mourning Melbourne family, locked out and let down.
The fact that he was lying in this cold morgue by himself, and God, it just killed us.
Jordan Grace had been living out his rugby dream in Perth. He was 3 days shy of his 21st birthday when he took his own life. His grieving parents tried to enter WA on compassionate grounds, but their appeal was denied.
And I put on the application quite clearly why we were going there, and it was just to go and identify our son, my baby.
Despite being double vaccinated, the Grace family was told they would need to spend 14 days in hotel quarantine before they could see their son.
There was no ifs or buts, it was just how it was.
Our son's dead in Perth and we can't...
This is just so sad. These people followed all the rules. They took the COVID vaccine, they're double vaccinated, they've done everything right, and they still can't do this one simple thing, which the vaccine was supposed to allow you to do. This is very ugly and it just keeps getting worse. Things in New Zealand are also getting kind of crazy. Let's hear what their Prime Minister has to say real quick.
We've also seen the spread of misinformation on COVID-19, particularly through social media. We had to act, so we made it a priority to establish a public interest journalism fund to help our media continue to produce stories that keep New Zealanders informed.
Well, after that spread of misinformation, as she says, now the state's going to be funding a brand new journalism situation where they can give you all the right information. Everyone in New Zealand trusts what we, the New Zealand government, have to say. Why? Because we say so. That's why. The headlines coming out of that institution are going to be so pathetically predictable. It's going to be amazing. Now let's head over to Germany. This first article comes from SHRM, and the title of the article is Germany imposes new workplace restrictions as coronavirus surges. Now, this was released December 9th. So as of November 24th, employees may enter their workplace only if they show so-called 3G certification that they're vaccinated against COVID-19, have tested negative, or have recovered from the coronavirus. German lawmakers also established a new work-from-home obligation requiring employers to offer employees that option if the nature of the work allows. The employee must accept the work-from-home option unless there's a clear reason not to work remotely. Both requirements expire March 19, 2022, with an extension beyond that date being possible. Employers must monitor compliance with the 3G requirements or face up to €25,000 in fines under the new regulations. Despite the new rules, employers cannot mandate employee vaccination, as there is no such requirement yet in Germany, according to Marin and Hoft. 68% of German population has undergone at least 2 COVID-19 vaccinations, and that was reported last month. Legal experts suggest that workers who refuse to comply with the new rules and can't work from home could face dismissal or have their pay withheld. But rest assured that, quote, in no case does different treatment between vaccinated and unvaccinated employees constitute as discrimination. Unvaccinated is not a prohibited characteristic for different treatment. What an amazing way to end that article. So yeah, there is no differential treatment between these two groups of people, except for the fact that we're doing everything possible to coerce one group to do what the other group has done. That's it. That's the only difference in treatment. Now, I haven't seen anything on the rates of anxiety or depression in adolescents in Germany. I only reported that one case from the US after that advisory from the Surgeon General. I can only imagine, though, that they're going to be seeing some similar trends. But this kind of behavior is not helped by what we're about to hear. Let's listen.
Well, there's some pretty scary stories. Just have to go north of Austria, which is obviously Germany. And there are 3 stories, I think, that tell a really good story. The first one was reported in Die Welt, which is the equivalent of The Guardian in Germany. And it's essentially about the ritual humiliation of children who are asked to go to the front of the class and state their vaccination status daily. Those who are vaccinated are applauded. Those who are not have to explain why they're not. So that's the one story I think that really kind of should.
So children who have no recourse in this situation to choose whether or not to get the vaccine, really, it's up to their parents for the most part and their doctor, are going to school and they're getting ridiculed. Either you have the vaccine and you get applauded, or you don't and you get shamed and you have to explain why not, when many of them, it's not their choice ultimately. There is no world where this kind of behavior ends well. If parents in Germany aren't involved in their kids' schooling, then they should definitely start getting involved. This is how it always works, little by little, until you realize one day you've lost a whole bunch. And in this particular case, it's not even little by little. This is a big chunk right in our faces. Now let's quickly go to the UK before finishing up with that paper. Let's start with a little bit of Prime Minister Boris Johnson's address to the UK.
No one should be in any doubt. There is a tidal wave of Omicron coming. And I'm afraid it is now clear that 2 doses of vaccine are simply not enough to give the level of protection we all need. But the good news is that our scientists are confident that with a 3rd dose, a booster dose, we can all bring our level of protection back up.
The most amazing part about all of these is, the good news is, and it's always the same good news, a 3rd dose. And by the way, that's the only possible way out of this. It doesn't mention anything. The 3rd dose is the only way out. And luckily for us, the scientists say that, yep, this is going to do it. This one's going to do the trick. Going into slightly more detail about what this tidal wave of Omicron means for the UK, I'm reading now from the AP. The chief medical officers in the UK were saying that at a time when COVID-19 is already widespread, they recommended raising the alert level from 3 to 4 on a 5-point scale, the top level being 5. This indicates authorities think the healthcare system is about to be overwhelmed. The UK Health Security Agency says that existing vaccines appear less effective in preventing symptomatic infections in people exposed to Omicron, though preliminary data shows that effectiveness appears to rise between 70% and 75% after a 3rd dose of the vaccine. Now here's one of the saddest parts of all this news, of this tidal wave, that Boris Johnson acknowledges that many routine medical procedures are going to have to be postponed to meet this goal of vaccinating everybody by December 31st. And finally, let's break down this paper. I'm only going to touch on a few key things from this paper. The link is in the descriptions. This is an excellent paper. I recommend everyone go read it. It's very telling, and I think we can learn a lot from this. This paper was sent out on December 8th, and the title is Evaluating the Number of Unvaccinated People Needed to Exclude to Prevent SARS-CoV-2 Transmissions. So first, why the paper? Vaccine mandates and vaccine passports are thought to be a path out of the pandemic by 1, increasing vaccination levels through coercion, and 2, excluding those who remain unvaccinated from many types of settings, for example, work and social gatherings. A central legal justification for exclusion is that unvaccinated people are viewed as being at significant risk of transmitting SARS-CoV-2, which is potentially the most serious externalized risk of the choice to remain unvaccinated. So their main goal is basically, is it actually an effective strategy to reduce transmission by excluding these people that are unvaccinated from a majority of social gatherings. Now, quickly, I'm going to define a term that's used a lot in the paper, and that term is NNE. And NNE is the number of unvaccinated people who need to be excluded from a setting to prevent one transmission event from unvaccinated people in that type of setting. So the NNE was calculated for 6 different types of settings: households, social gatherings, so for example, meals, conversations, social gatherings with friends and family, casual close contacts, public areas and buildings, work or study places, healthcare, and travel and transportation. So this first table shows the estimates of the secondary attack rates to model the NNEs for each setting. Now, the secondary attack rate is the infection risk among the contacts of the unvaccinated index case, and the NNE pertains to one transmission event. So this table 1 displays the wild type versus the corrected, robust secondary attack rate for each type of setting. So the predicted household secondary attack rate for the Delta variant was 26% higher than the observed secondary attack rate pooled across recent studies of unvaccinated index cases infected with the Delta variant who had come in contact with primarily household members. So what this means basically is that their assumption was very conservative because they had to increase the secondary attack rate more than what was observed in the real world. So this happened repeatedly and is one of the reasons why they think that likely the NNEs are the minimum value of NNE instead of the average or maximum. So in their results, they found that the NNEs suggest that at least 1,000 unvaccinated people likely need to be excluded to prevent just one SARS-CoV-2 transmission event in most types of settings for many jurisdictions, notably Australia, California, Canada, China, France, Israel, and others. Now, their second table goes through the global estimates of the number of unvaccinated people that they would need to exclude, so the NNEs, to prevent just one SARS-CoV-2 transmission event. And it's like this table goes for, a couple of pages. And you can see that the vast majority of countries and territories would have to have more than 1,000 unvaccinated people excluded in order to prevent one transmission event. There were 4 main implications from this study. First, as we stated, the 2 conservative assumptions of the model mean that the calculated NNEs likely represent the minimum number of unvaccinated people needed to exclude to prevent one SARS-CoV-2 transmission event in each jurisdiction and type of setting. Number 2, while SARS-CoV-2 vaccines are beneficial, the high NNEs suggest that excluding unvaccinated people has negligible benefits for reducing SARS-CoV-2 transmissions in many jurisdictions across the globe. This is because unvaccinated people are likely not at significant risk in absolute terms of transmitting SARS-CoV-2 to others in most types of settings. Third, societies and policymakers should urgently consider the harms of exclusion via vaccine mandates and vaccine passports. This is because these NNEs suggest that exclusion may not be a proportionate response to the risk unvaccinated people pose to others. They note 4 harms to be considered by these rules. Number 1, there is the possibility of staffing shortages from the loss of unvaccinated healthcare workers, which may have downstream effects on patient care. 2, there is harm of unemployment and in some cases unemployability if vaccines are a condition of employment or higher education in most organizations. 3, this would mean unvaccinated people and their families will face financial hardships. This may have downstream effects on their mental, physical health. And a 4th harm of exclusion is the creation of a class of citizens who are not allowed to fully participate in many areas of the society. And finally, 4th, we suggest that the NNE and the baseline infection risk, which is the point prevalence of infectious cases, be included as key indicators for determining the harms versus benefits of the vaccine mandates and vaccine passports. This paper has massive implications to policy, and I recommend anyone that is listening to this and knows a politician or knows how to get things to their politicians, submit this letter, this essay, and tell them to read it. I think, hopefully, if they're honest, it'll be an eye-opening experience, and they might curtail some of their responses to COVID in light of this new data. And that's going to wrap it up for today. Thank you so much for listening. I know it was a long episode, and I know we covered a whole bunch of things. If you like this content, please share, and please tell your friends to subscribe so we can get more listeners out there. I hope you all have an excellent Monday. Please enjoy this video, and I'll see you guys again on Wednesday.
See ya!